Assalamualaikum warahmatullahi wabarakatuh and very good day. So today we continue with the chapter entitled Fat Soluble Vitamin. Okay, there are four main type of fat soluble vitamin. Vitamin A, D, E, K. So why the name is fat soluble? Because this vitamin dissolve in fat. Okay, because of the vitamin is dissolved in fat, so we need to eat dietary fat to improve the absorption of ADEK vitamin. So excessive of the vitamin can be stored in the body, and we have to change the lifestyle. For example, the dietary habit to change the status of this vitamin in our body. So we have to improve the intake of ADEK and also dietary fat in order to improve or meet the requirement of this vitamin. Okay, let us look at two main types of vitamin A, active vitamin A and also provitamin A. So active vitamin A is referred to preformed vitamin A, which means that you can obtain directly from your food. The vitamin A is directly get from the food. Then one example of the active form of vitamin A is retinol. Okay, provitamin A is referred to a substance that transforms into vitamin in the body. Means that you have to eat this substance in order for your body to form vitamin A. For example, beta carotene. So beta carotene is the most abundant and widespread but provitamin A. So in order for your body to form vitamin A, you have to eat beta carotene to form vitamin A. Okay, there are two forms of vitamin A. Can you remember? Active and provitamin A, right? So retinol is active form of vitamin A, whereby beta carotene is the example of provitamin A. So retinol you can find these types of substance from animal food, for example from liver, meat, fatty fish, egg, and also fat, milk fat. Okay, beta carotene you can find it from plant-based food, for example dark green leafy vegetable, and also bright yellow fruit, for example carrot. Okay, so let us look at the function of vitamin A. So vitamin A is very important for normal vision, to improve the normal vision, especially in the dark. They also have to maintain and rebuild a glandular, glands. There are many glands in our body, so to help in rebuilding this glandula, we have to eat a lot of vitamin A and also to rebuild epithelial tissues. Okay, the next function of vitamin A is necessary for normal skeletal growth of human being. So this is our function of vitamin A. Okay, let us look at what will happen in our digestive tract when we eat vitamin A, carotenoid and retinol. Okay, can you remember carotenoid? What type of what type of vitamin A? Yes, good. Provitamin A. Okay, so in order for your body to form vitamin A, you have to eat carotenoid substance that transform into vitamin A in our body. How about retinol? The active form of vitamin A. So your body will directly use the vitamin A by absorbing this retinol. Okay, so carotenoid and retinol released from food protein combine with bile to form micelles. So this diagram shows the micelle structure. So they have two characteristics which is very important to form this structure. Okay, hydrophilic head. The head is having a characteristics known as hydrophilic. Means hydro means water, philics means love or like water. So they love to move towards water. However, the tails, the orange color, okay, is referred to the hydrophobic tails. Hydro means water, phobic means don't like, phobia, they don't like water. Okay, the tail move away from the water. So this, because of this characteristic, so they form a micelle structure. Okay. So how about the absorption, percentage of the absorption of vitamin A, two form of vitamin A? 70 to 90% of pre-form, the active vitamin A is absorbed in our body. So it is very good for us to eat a substance that contain active form of vitamin A because our body will directly absorb this substance. However, absorption of carotenoid, which is the provitamin A substance, means that you have to eat this carotenoid, and your body will transform this carotenoid to vitamin A in the body. So this type of vitamin is less efficient, okay, in terms of the absorption in the body. So how to improve the absorption of the vitamin A? So as we know, vitamin A is fat soluble vitamin that dissolve in fat. So we have to eat vitamin A with diet that contain fat. So this will improve the ability, okay, and also the amount of vitamin A that is absorbed in the body. So once the vitamin A absorbed in the body, it will transported from the intestine in kilomicron. Can you remember in lipid chapter, we have covered about the lipid transporter, for example HDL, LDL. So other type of lipid transporter is kilomicron, the largest lipoprotein. So absorbed vitamin A is transported from the intestine by using kilomicrons. So retinol can be transferred from liver to the tissue by being bound to retinol binding protein. Okay, whereas the carotenoid are transported by lipoproteins such as kilomicron. These two forms of vitamin A have different function in the body. Okay, beta carotene is a provitamin A substance. Okay, beta carotene is used in our body to form a vitamin A. So it have two main function, which is a vitamin A precursor and also an antioxidant. Antioxidant is an agent that reduces cancer. Okay, reduce risk of having cancer. Okay, so beta carotene can be converted to vitamin A in the intestinal mucosa and also in the liver. So unconverted, which is beta carotene, can be converted into vitamin A. So this unconverted carotenoid may function as antioxidant, which is also useful for our body, whereby it can reduce the risk of having cancerous cells. So in order for you to reduce risk of having any cancer, you can eat vitamin A from your diet, okay, because it have antioxidant properties. Okay, other vitamin A carotenoid, also known as a alpha carotene and beta cryptoxanthin. Non-vitamin A carotenoid, for example, lutein, lycopene, and zeaxanthin, because they cannot be converted to retinol. So this vitamin is known as non-vitamin A carotenoid. Okay, when we look at the function of vitamin A, vitamin is importantly needed for reproduction, growth, and immunity. In reproduction, vitamin A is needed to direct cell to differentiate and to form shapes and pattern needed for a complete organism. So if you learn about biology, so you learn about the cell division. So there is a differentiation process whereby the cells will differentiate into different type of cells to form a complete organism. So vitamin A is very important during differentiation of the cells. Okay, in growing children, vitamin A affects the activity cells. A deficiency early in the life can cause abnormal jawbone growth, okay, or resulting in crooked teeth and poor dental health. So this is an example of the um, these abnormalities. Okay, so in immune system, vitamin A is needed for the differentiation that produce the different type of immune cells. If you learn about immunity, okay, we have a different type of immune cell. For example, T cell, T helpers, and also others. So in differentiation of the immune cells, we also need vitamin A. Okay, recommended vitamin A intake in microgram per day of retinol. Okay, 900 for men and 700 for women. The requirement for vitamin A intake increase among pregnant mother and lactating mothers. Okay, so according to WHO, vitamin A is important for visual health, immune function, and also factor growth and development. So vitamin A deficiencies in our is a public health problem in many parts of the world, particularly Africa and Southeast Asia. Okay, so although pregnant women are susceptible to vitamin A deficiency throughout gestation, susceptibility is at its highest during the third trimester of pregnancy, during the accelerated fetal development and physiological increase in blood volume during this period. While this is some indication that low doses of vitamin A supplement given to pregnant women on a daily or weekly basis starting in the second and third trimester can reduce the severity of decline in maternal serum retinol level during late pregnancy and the symptom of night blindness. Current evidence indicates that vitamin A supplementation during pregnancy does not reduce the risk of illness or death in mothers or their infant. Okay, pregnant women should be encouraged to receive adequate nutrients, which is best achieved through consumption of healthy, balanced diet. So vitamin A needs can be met with plant and animal source. So we can obtain vitamin A from the plant-based food such as carrot, tomatoes, okay, and retinoid preformed vitamin A can be obtained from animal-based food, okay, such as egg, meat, and liver. Okay, let us look at the deficiencies of vitamin A effect on the health. Okay, as we all know, one of the main functions of vitamin A is to maintain or improve the normal vision in inner darkness. Okay, so an estimated 100 to 140 million children worldwide are vitamin A deficient. There are not enough vitamin A in adequate vitamin A. Okay, about 250,000 to 500,000 children go blind annually due to vitamin A deficiencies. So inadequate vitamin A will lead to blindness. Okay. So vitamin A deficiencies can be caused by insufficient intake of vitamin A, fat, protein, or zinc. So we have to overcome the blindness or the health effect by increasing the intake of vitamin A in our diet. Okay, one of the main effects of vitamin A deficiencies is xerophthalmia. Xeroph means dry. Okay, ophthalmos or meaning eyes. So xerophthalmia is actually a term referring to a medical condition in which the eye fails to produce tears. Okay, so this is abnormal dryness of the conjunctiva and cornea of the eye with inflammation and ridge formation. Typically, xerophthalmia is associated with vitamin E deficiencies. So next, let's look at the vitamin A toxicity. If we take excessive vitamin A, for example, preformed vitamin A can be highly toxic, both acutely and chronically. Acute means short term and chronic means refers to the long term effects. So upper limit, okay, the maximum level of vitamin A intake for adults is 3000 microgram per day. Excess vitamin A intake during pregnancy may contribute to birth defect. So if we want to improve the vitamin A, make sure there's no excessive vitamin A intake, okay, especially for pregnant mother. Carotenoids are not toxic, but large dose can lead to hyperkeratinemia. Hyper means high, keratin is referred to carotenoid, mia is within blood. So high level of keratin in blood. Okay, so carotenoid supplements may be harmful to cigarette smokers and increase in lung cancer. Okay guys, so this picture shows the hyperkeratinemia effects. Okay, the effect of keratinemia, high keratin level in blood will turn you to orange. Eating too many carrots really can turn you orange. So this picture shows the normal reddish hand. Okay, so this is the orange color hand when the excessive intake of vitamin A. Okay, so the eyes also turned orange. Okay, so this is the symptoms shows when we take a lot of vitamin A. Okay, thank you for your attention. Okay, we continue with the vitamin D, E, and K, which is other type of fat soluble vitamin in next lecture. Okay, thank you. Bye.